What is dysphagia and how does it affect my child? Approximately 25% of children have difficulty with eating, drinking, and swallowing. This is known as dysphagia. This can present as behavior around mealtimes, picky eating, frequent spitting up of food, refusing to eat, and/or reluctant weaning. Your child's eating, drinking, and swallowing function is monitored from birth throughout infancy to adolescence, ensuring that your child is getting their required nutrients. It is important to identify any eating, drinking, or swallowing difficulties your child may be having. There are many risk factors and/or indicators of childhood dysphagia, such as low muscle tone, a reduced sucking reflex, and/or birth complications. Assessment and management are supported by a multidisciplinary team of healthcare professionals to ensure your child gets the nutrients they need to thrive. Dysphagia and communication. There are several factors that could be the cause of your child's eating, drinking, and swallowing difficulties, which may also affect how well your child communicates. This could include physical factors like structural differences of their head, neck, and throat, which may change how clear speech is. If your child is not receiving the nutrients they need, this will affect their natural growth and development, potentially affecting when they meet their communication milestones. How can a speech and language therapist help? Speech and language therapists are specially trained in the anatomy of the head, neck, and throat. This means that they have studied and understand the phases of a healthy swallow. Speech and language therapists know what is supposed to happen during eating, drinking, and swallowing, what may cause dysphagia, and how to distinguish if there are structural or mechanical issues with your child's swallow. Alongside a speech and language therapist, other allied health professionals will work together with caregivers to determine what difficulties your child may be experiencing with eating, drinking, and swallowing, regardless if that is due to dysphagia, food reluctance, or preferences. Once a decision has been made, strategies or intervention recommendations should be provided to help make mealtime safer, less stressful, and more successful. At your first appointment, you will meet with a speech and language therapist to discuss the challenges you are experiencing with your child's eating, drinking, and swallowing. You should bring food or a snack to the speech and language therapy appointment so they can observe how your child is eating. This allows the therapist to assess how effective your child's swallow is and if there are any observable concerns. The speech and language therapist may also ask to look in your child's mouth or feel your child's head, neck, or throat to assess if there are any structural concerns happening internally that cannot be seen through observation. If you have any other questions or concerns, do not hesitate to contact your local speech and language therapist at 044-0123-456-789 or at the email sltdysphagia@gmail.com. Alternatively, try incorporating a few of these feeding tips into your daily mealtime routines with your child to help reduce stress and make mealtimes easier. Number 1. Fed is fed. It's better that your child eats something than nothing at all. Know that they will continue to get the nutrients they need to be growing and to be active regardless if they are eating from all categories of food or not. Number 2. Stress-free mealtimes. Trying to remain positive can reduce your child's feeling pressured to eat. Try making mealtime stress-free by having options available in bowls or giving your child the choice of what they want to eat from the table. Number 3, explore food. Allow your child to play with and explore their food so they can experience it with other senses before they taste it. Number 4, having designated eating times. It's important that your child gets hungry so they are motivated to eat. If they are grazing and eating all day, they won't be as motivated or hungry for a meal. And number 5, try to have one new food a meal. If you're introducing one new food per meal time, it gives your child the choice to add it to their plate or not. Even if they don't eat it, it gives them the opportunity to experience and to get to know new foods. If you still have questions or feel unclear on what difficulties you and/or your child are experiencing with eating, drinking, and swallowing, make sure to check out some of the links and resources posted in the comment section of this video.